movement disorders in our medical moment.
Fox 17's Tim Doty learns about treatment options and how Spectrum Health Medical Group uses a team approach.
When a Parkinson's disease diagnosis is reached, Dr. Hayden Boyce and the multidisciplinary team at Spectrum Health Medical Group go into action.
All of our patients are evaluated by neuropsychology. They're evaluated by psychiatry, physical therapy, occupational therapy, speech therapy, both for speech as well as swallowing.
Dr. Boyce says the use of such a large team is actually pretty rare, and Spectrum has the only one in West Michigan.
You have to be a team player if you're doing a if you're in a movement disorder program, because you need this feedback from other people. It helps guide your surgery. It helps guide which patients are good candidates or not. I mean, this is the way that it has to be.
Patients have several options for treatment. Medicine works for many, while others receive deep brain stimulation, where electrodes are implanted in the brain.
Once we have achieved the target, then we put the real electrode in. We call that the macro electrode, and then we actually test intraoperatively to look at the suppression of the tremor intraoperatively. We're also checking to make sure there aren't any side effects.
So you're doing this while the person's on the table right there. You're testing everything.
Yes, the patient is awake and we're testing and they're talking to us.
Surgery is also an option, where the affected brain tissue is burned away, though that's a technique that isn't as common in 2014.
What you're actually doing is you're producing damage to the brain. So you're going in and you're damaging a certain area of the brain in order to ameliorate the tremors. The beauty in doing the deep brain stimulation is that this is reversible.
Once the procedure is completed, the patient isn't left on their own. The multidisciplinary team continues to check in with them.
After surgery, all of our patients will continue to undergo neuropsych as well as psychiatric evaluation, because there's these other comorbidities that can take place due to the disorder itself that we have to monitor for. With Parkinson's disease and essential tremor, essentially you can actually improve a patient's quality of life to the point where for all intents and purposes, they can go back to the life that they had 10, 15 years ago.
Tim Doty, Fox 17 News.
Oh, the weather outside is frightful, but the video I've got for you is so delightful. Tigers, full team, reporting to spring training today. Just take a second, soak this in.